Apologize. We will get him hooked up in just a moment. Dr. Baugh, give me your lay of the land right now and how you see everything progressing.
Yeah, I get to see it from sort of two aspects, because not only do I work as the Chief Medical Officer for Remote Health Solutions, a telemedicine company, but I'm an emergency medicine physician as well. So where I practice medicine at, we do worry about the shortages of PPE, and we also worry about that sort of constant exposure, because one of the things that we know is that increased exposure, increased viral load, which has worse outcomes for those people who then succumb to or have real COVID-19 disease. So when we talk about that, we say, how can we mitigate this? How can we lessen our exposure as individuals and also as healthcare providers? And so we look to technology and other ways to be able to limit our exposure.
About the nurses and doctors that are on the front lines, how are they, and you and anyone in the hospital, protecting themselves?
Yeah, that's a great question. One of the things that we look at is every patient that comes in right now is considered if they have any of the symptoms, if they have a fever, if they have a cough, if they have shortness of breath, then I naturally assume, well, they're going to be a COVID patient, a COVID-19 patient, and so that's how we treat them. So we are using N95 masks, and we are using standard medical masks and goggles and coats and gloves as well. So every single patient, we sort of gown up for for the worst case scenario, and that is a change in how we normally practice, because we don't normally have to go to the same extensive covering that we normally would. Normally wash our hands, wear some gloves, but with this increased exposure and this increased risk for us, we have to be thinking about us, and we have to be thinking about our family, and we're doing as many things as we can.
Dr. Hibbard, we have sound now, I hope. I wanted to hear from you, sir, what the experience is in Florida.
We're seeing the same problem with personal protective equipment that you're hearing from nurses and other healthcare providers, indicating that they're not always able to find the numbers of PPEs that they want. Most of the providers in Florida who are working in regional emergency rooms here have access usually to one or two N95 masks, and they're using a surgical mask over top of that they change between patients. That's obviously not optimal, but that's the current state of the affairs. And I think a lot of people now are starting to adhere more to using protective equipment, masks and gloves, even outside of the patient contact areas. And I think that's very important, that our healthcare people have some protection themselves. I think it's also very important for us to set the record straight and realize that when you're walking into a hospital, that you're walking into an area that you don't want to be a petri dish. So when we're encouraging people to wear masks and gloves outside, I think we need to encourage every hospital, every administrator, and every person who works in a hospital to follow those same measures.
Dr. Baugh, telemedicine obviously has become so popular now, and a lot of people are fortunate to be able to call or Skype with their doctor. Has that been able to limit the amount of folks that you've seen in the hospital, or are people still walking into the hospital?
I think that it really has, because I know that I'm pretty lucky where I practice medicine at. So we're still at the front end of the curve as far as the number of COVID patients that we're seeing. And so what's actually done is the number of patients that we're seeing in the emergency department has gone down, because people are able to use telemedicine to talk with their physician or a provider group for the other things that they might come if they've got a sore throat, or if they've got a cough that they think is not related to this, or if they've got an upset stomach or something. They can have those visits with a provider without having to come in and see me in the ER, where we have limited resources. And as we know that number of COVID patients that we will see increases, we hope that this trend continues so that we can focus our energy and effort on those truly sick patients. We're still going to have strokes. We're still going to have heart attacks.
I want to very quickly get to Dr. Hibbard before we go here. Are you seeing an increased wave of patients? And if so, how is this different from what you normally deal with?
The wave that you're seeing in New York is not happening in Florida yet. In fact, the volumes at the emergency rooms have been decreased. I've talked and discussed with my colleagues also in other areas, in other states, also in the western states, and they're all seeing decreased volumes. In fact, some of the groups are cutting back some of the physician hours because the volumes have significantly decreased. So we're not seeing what they're currently experiencing in New York. We're not seeing that in Florida yet. All our volumes are down.
Okay. Good
Like
to know.
70% of normal is the standard, about 60 to 70%.
Okay.
And it's pretty well similar throughout most of the other parts of the country from what I read from my colleagues and their discussions.
Dr. Peter Hibbard, thank you, sir. And Dr. Jonathan Baugh, thank you as well, sir. Coming up, we'll have continuing coverage of coronavirus outbreak.